Hello everyone, welcome back. Today we'll be studying about maternal pelvis. So basically pelvis composed of 4 bones and 4 joints. Clear? So what are the bones now? That is 2 innominate bone or hip bone composed of 3 parts, that is ilium, ischium and pubis. 1 sacrum and 1 coccyx. Now joints of pelvis are 2 sacroiliac joint, 1 sacrococcygeal joint and 1 symphysis pubis. So come to image now. Yeah. So this is the sacroiliac joint. Can you see? Yeah. This is the sacroiliac joint. Number is 2. Clear? Now what is sacrococcygeal? Between sacrum and coccyx, right? Sacroiliac means between sacrum and ilias. Okay? Yeah. Now coming to 1 symphysis pubis. What is that? That is this one. Can you see? Yeah, this one is the symphysis pubis. Next is types of pelvis. Based on shape of pelvic inlet. The first one is gynecoid pelvis, that is 50%. A normal true female pelvis, like more than 50% or basically normal true females are having gynecoid pelvis. Most favorable pelvis for pregnancy and delivery of the baby. Shape of inlet or brim is rounded. This is exam based question. So gynecoid pelvis is rounded. Woman shoe size of 4 or larger, they are having gynecoid pelvis. It is well suited to childbearing, as I was telling that thing only. A wide sciatic notch and a subpubic arch of 90 degrees. Okay, it is found in women of average build and height. So basically what is the gynecoid pelvis? That is 50% of normal true female pelvis that is well suited to childbearing, and women shoe size of 4 or larger, they are having gynecoid pelvis. Can you see the image? Yeah, this one. See, it is rounded one. Yeah. So, and a wide sciatic notch and a subpubic arch of 90 degrees, it is present. Okay. Now next one is anthropoid. What is that? That is 25%. A structure abnormality that occurs in about 25% of women. Shape of inlet or brim is long oval shape. Can you see? This is oval one. Yeah. Oval shape, mostly present into tall women. So those women who are tall, they are having this type of pelvis. Adequate outlet with a narrow pubic arch. So this is the characteristics of anthropoid pelvis. Labor usually does not present any difficulties. In those female who are having anthropoid pelvis, generally they are not having any difficulties in labor, right? So what is the characteristics of oval shape? That is adequate outlet with a narrow pubic arch. Clear? And it is seen in tall women. And the shape or inlet or brim is, that is long oval shape. Clear to all of you? Now coming to android or masculine pelvis, that is 20%. First one was 50%, that is gynecoid pelvis. Second one is 25%, that is anthropoid. And 20% it is for android or masculine pelvis. Clear? Now coming to what are the characteristics? Shape of inlet or brim is heart shape or angulated. Resemble as male pelvis, so not favorable for labor and vaginal birth. So basically it is a male pelvis, right? It is not suitable for delivery. The angle of pubic arch is less than 90 degrees. This is the important one, that the angle of pubic arch is less than 90 degrees. It is found in short and heavily built women. Those women who are short in size and overweight, right? Heavily built women, they are found to have masculine pelvis. Slow descent and mid-pelvic arrest due to narrow pelvic planes. So there are many planes in pelvis. Now we will be discussing in next slide. So now you can see that slow descent and mid-pelvic arrest can be happened in case of masculine pelvis. So those women who are short and heavily built, they can have these difficulties. Ischial spines are prominent here, which prevent internal rotation of head, so anterior-posterior diameter become caught on them, causing a deep transverse arrest. So they may ask in exam that what is the difficulties in android or masculine pelvis. So there can happen a deep transverse arrest, slow descent and mid-pelvic arrest due to narrow pelvic planes. So you have to remember all these points for android pelvis. You can see the image as well. See, ischial spines are prominent here. Okay, and it is heart shape. In Instagram heart we are drawing, right? That heart only. Okay. Now coming to platyploid or kidney shape, right? We call it kidney shape pelvis. Shape of inlet or brim is kidney shape here. Anterior posterior diameter is short and transverse diameter is wide. See the image? Yeah, this one. Here, this one is, yeah, this one is platyploid, right? So what is their characteristics now? Anterior posterior diameter is short and transverse is more. See, this is the transverse diameter. I am showing you the transverse. This one is transverse diameter, right? And this is anterior posterior. So this is short one and transverse is larger, yeah, wide, right? And it is also not favorable for delivery. Clear to all of you? In lab also you can see different type of pelvis. So for now theory part, I am covering all these types of pelvis. Hope it is clear to all of you. If any doubt, please let me know. Okay, now coming to next point, that is divisions of pelvis. Anatomically it is divided into two divisions by obstetric significance, that is false pelvis or pelvis major or greater pelvis. So what are the name? That is false pelvis or pelvis major or greater pelvis. The portion of the pelvic cavity that lies above the pelvic brim. What is the pelvic brim? This round one. If you were seeing in gynecoid pelvis, okay, I am showing you. Yeah. Basically this part. See. This is the pelvic brim, right? So in case of false pelvis, na, that pelvis will be, yeah, the portion of pelvic cavity that lies above the pelvic brim. That brim I was showing you, in that case, that portion will be above the pelvic brim. It supports weight of growing uterus during middle and last trimester of pregnancy and abdominal viscera. So it supports weight of growing uterus during middle and last trimester of pregnancy and abdominal viscera. Clear to all of you? And it has no obstetric significance. So basically in false pelvis, when the mother is in middle and last trimester, right? So in case of when growing uterus is happening, yeah, uterus is growing, that case it is seen. Basically it has no obstetric significance. Boundaries of false pelvis, that is anteriorly, that is abdominal wall, posteriorly, that is lumbar vertebra, laterally it is iliac fossa. So who all are supporting that false pelvis? Anteriorly, मतलब सामने से क्या है? Abdominal wall है हमारा. Posterior में क्या है? Lumbar vertebra, thoracic, cervical, thoracic, lumbar, sacral, coccygeal, right? So that lumbar, it is supporting from posteriorly. And laterally it is iliac fossa. What is iliac fossa? If you can see this one, this is the support one. Can you see? Yeah, this is iliac fossa. Okay, hope it is clear to all of you. Yeah, now coming to true pelvis or lesser pelvis. Okay, the portion of the pelvis lying below the iliopectineal line or pelvic brim. So now the portion of pelvis, this is lying below the iliopectineal line or pelvic brim. I was telling you the brim, right? That rounded one, basically that brim. So now it is lying below. Okay, the dimension of the true pelvis are of obstetrical significance in determining the success of fetal descent. So the dimensions of true pelvis are of obstetrical significance in determining the success of fetal descent. Now division of true pelvis, that is true pelvis is divided into three regions now, that is inlet, cavity and outlet. Clear to all of you? Now what is inlet now? It is formed by the iliopectineal line of the innominate bone and the sacral promontory. Now we will be seeing the what is that sacral promontory and iliopectineal line. Okay, see here it is marked already. This is the iliopectineal line. Can you see in image? Yeah. Basically this is iliopectineal line. It is written also here, iliopectineal line. Yeah. Now it is oval or rounded like apple shaped in the female and heart shaped in male. Heart shaped means anthropoid and rounded in female, that is gynecoid, right? Now only we have studied. So it is a boundary lining of false and true pelvis. Now by this iliopectineal line of innominate bone and sacral promontory, where is that? That, see, this is the sacral promontory. Can you see? Yeah. So this is sacral promontory. By these two, we are basically boundary lining of false and true pelvis. Now landmark of brim. For 8 bony landmark of brim, that is posterior to anterior, let's see in diagram now. Okay, that is A to H. See, now we'll be seeing the diagram. Yeah. So first one is A, right? That is sacral promontory that we have already studied. So this one is sacral promontory. Now is ala of sacrum. This portion is ala of sacrum. Clear? Yeah. Now coming to sacroiliac joint. What is that? That we have already seen. I am showing you by this image. Yeah. This line is sacroiliac joint. Clear? Now coming to iliopectineal line, that is also already have been marked. So this is iliopectineal line. Now coming to iliopubic eminence. What is that? That is this one. See, iliopubic eminent. Okay, hope it is clear. Now next one is pectineal line. This one is pectineal line. Okay, I am using another color, then it will be clear to all of you. This is iliopectineal. Okay, sorry, first one was iliopectineal line, right? This one. Now this one is only pectineal line. Okay, now pubic crest, what is that? That is this one. Can you see? Yeah, this one is pubic crest. Clear? And this portion is pubic symphysis. Can you see this one? This one? This is pubic symphysis. Hope it is clear to all of you. I am revising once again. See, this A1, that is sacral promontory. Can you see this one green mark? Then B, that is ala of sacrum, this portion. Okay, then coming to sacroiliac joint, that also I have told you this portion. See, sacrum, between sacrum and iliac. Okay, then D is iliopectineal line. Next one. Next, iliopubic eminence. Then pectineal line followed by pubic crest, then symphysis pubis. Hope it is clear. It is also asked in clinical question, right? In case of viva or university exam, they may ask you the external teacher and internal teacher both. So hope you have understood. If any doubt is there, please let me know. Okay. In lab also you can practice with the pelvis. Clear? And practice among your group. That will be helpful before exam. Clear? Okay. Now coming to inclination. What is inclination? In erect posture, the pelvis tilted forward and makes an angle of 55 degree with horizontal, which called angle of inclination. Radiographically measure angle between plane of inlet and body of fifth vertebra is 135 degree. So what is inclination? That is leaning from the normal. An erect posture, the pelvis tilted forward and makes an angle of 55 degree with horizontal, which called angle of inclination. Radiographically measure angle between plane of inlet and body of fifth vertebra is 135 degree. Now coming to brim have 4 principal diameters, that is anteroposterior diameter, 1 transverse diameter and 2 oblique diameter. Okay, let me show you in picture as well. Okay, I am showing you in this picture. Okay, yeah, let's see. This one is anteroposterior diameter. Can you see? Yeah, this one. This is anteroposterior. Now coming to transverse diameter. What is that? That is, this one is transverse diameter. Clear? And what is oblique diameter? That is 2. This 2. This 2 is oblique diameter. Hope it is clear to all of you. Okay. So this 4 diameter is present in brim. Okay. Now coming to anteroposterior or conjugate diameter. What is that? There are 3 anteroposterior diameters. Among them, only diagonal can be measured by PR vaginal examination. This is very important. Okay. So what is only measurable? That is diagonal is only measurable. First one is anatomical or true conjugate or conjugate vera, that is 11 centimeter or 4.414 inch. Okay, like that you can remember. Distance between superior point of the sacrum at midline and the upper and inner margin of symphysis pubis. So what is that? That superior point of sacrum at midline and the upper and inner margin of symphysis pubis. Okay, here it is shown. Let's see in picture now. Yeah, this one is symphysis pubis. And now what is that? That first one, the distance between superior point of sacrum to upper and inner margin of symphysis pubis. This is the upper portion, right? This is the upper portion of symphysis pubis. So this one is true conjugate. Clear? Now it is measured by subtracting 1 to 1.5 centimeter from diagonal conjugate. Diagonal minus 1.5, that is 11 centimeter, and this will be called true conjugate. Okay, true conjugate or conjugate vera, that is 11 centimeter. You have to remember that superior part or superior point of sacrum at midline and the upper and inner margin symphysis pubis, this distance is called true conjugate. Clear to all of you? Now coming to obstetric conjugate. What is that? That is 10 centimeter or 4 inch. That is also called, it is the distance between midpoints of sacral promontory to prominent bony projection at the middle part of the inner surface of symphysis pubis. Okay, I am showing you in a picture. Let's see. This is the superior midpoint of sacral promontory, right? This is the sacral promontory, and from that point, middle point of symphysis pubis of inner part, right? This is the inner surface. This is coming inner, and this will be the outer part. This is outer, right? This is not the inner part. This is the inner part. So now Hope it is clear to you. This is the obstetric conjugate and it is measured as 10 centimeter. Clear? Now what is the characteristics? Let's see. It is the shortest anterior-posterior diameter to which the fetal head must be accommodated to descend successfully through the pelvic inlet. As it is the shortest one, so the fetal head should be accommodated to descend successfully through this pelvic inlet. It is measured by subtracting 1.5 to 2 centimeter from diagonal conjugate, that is diagonal minus 2, that will be coming around 10 centimeter, right? So it is called obstetric conjugate. Now coming to diagonal conjugate, which is significant in obstetrics. So let's see. And it is the only measurable anterior posterior per vaginal. Okay, per vagina it is measurable, right? So let's say it is the distance between lower border of symphysis pubis to midpoint of sacral promontory. Okay, it is only diameter which can be measured by intravaginal finger examination. So this is measurable and it is around 12 centimeter. Okay, let's see in picture as well. Let's again from the sacral promontory to this point. This is the diagonal conjugate. Okay, and this will be the lower border of symphysis pubis, as I have already told. So upper border of symphysis pubis, it is a true conjugate. Okay, anatomical or true conjugate or conjugate vera. It is also called conjugate vera, that is 11 centimeter. Diagonal minus 1.5, it is coming around 11 centimeter. Diagonal minus 2, it is coming. It is obstetric conjugate. This is the middle point of pubic symphysis or symphysis pubis. Okay, and diagonal will be the lower border of symphysis pubis. Now coming to transverse diameter, that is around 13 centimeter. This one is transverse diameter. Can you see? Yeah, this is the transverse diameter. So what is that? It is the distance between two furthest point on the pelvic brim over iliopectineal line. See, in this picture we have studied in iliopectineal line, right? Yeah. This is the landmark, one of the landmark, right? So iliopectineal line, that is to distance. What is that? That is the furthest point. Okay, furthest point on the pelvic brim over iliopectineal line. It is largest diameter of pelvic brim or inlet. Oblique or diagonal diameter, that is 12 centimeter. Distance between sacroiliac joint to opposite iliopubic eminence. Okay, so this one, this iliopubic eminence, can you see? I am showing you by this exam. Sacroiliac joint, can you see this point? Sacroiliac joint to opposite side of iliopubic eminence. Clear to all of you? Don't be confused with ischial spine. That is not oblique. Okay, that is different one. Iliopubic eminence. Image is showing you the distance between sacroiliac joint and iliopubic eminence. It is not clinically measurable. So let's see in diagram. Altogether anterior posterior, that is 11 centimeter. In brim cavity it is 12 and outlet 13. It is largest one in outlet. Okay, and oblique it is all the same, that is 12 centimeter. You can remember like this, 12 12 12. Okay, brim cavity outlet like this, and transverse this will be opposite to anterior posterior. In brim it is 13 12 11. 12 in cavity, you can see all are same in cavity. That anterior posterior, oblique and transverse all at 12 centimeter in cavity. Now in case of brim it is 11 12 13, like that also you can remember, and outlet that will be opposite, that is 13 12 11. For memorizing, it is the shortest trick. Now it is your choice how you will remember this, but they may ask in exam, so you have to study well. Okay, now cavity is rounded shape. segment of pelvis bounded above by inlet and below by plane of least pelvic dimensions. Diameter of cavity, that is pelvic midplane diameter. The cavity is circular in shape and it is not possible to measure its diameter exactly. Okay, now what is cavity? Cavity is rounded shape, segment of pelvis bounded above by inlet and below by plane of least pelvic dimension. Diameter of cavity, that is pelvic midplane diameter, is circular in shape and it is not possible to measure its diameter exactly. They all are considered to be 12 cm. As I have told you that anterior, posterior, oblique and transverse all are same for cavity, that is 12 cm, and anterior posterior, that is 12 cm. The distance between middle of symphysis pubis and the upper border of third sacral vertebra, it is the largest diameter in anterior posterior direction. Transverse, interspinous diameter, distance between two anterior superior spines of the ilia. Clear to all of you? Then oblique, it is 12 cm. Now coming to outlet. Okay, anatomical outlet or bony outlet, that is the lower pelvic opening between the tip of coccyx posteriorly, the ischial tuberosities laterally and the lower margin of the symphysis pubis anteriorly. So what is outlet? The lower pelvic opening between the tip of coccyx posteriorly and ischial tuberosity laterally and lower margin of symphysis pubis anteriorly. Okay, now shape of outlet is diamond shape. Okay, now coming to diameter of outlet, that is also anterior posterior, that will be the distance between tip of the coccyx and lower edge of the symphysis pubis. Transverse, this is 11 cm, the distance between inner border of ischial tuberosity. Okay, and oblique, this is, although there are no fixed point, instead of that it's said to be measured between obturator foramen and the sacrospinous ligament. So in case of outlet, the oblique diameter will be measured between obturator foramen and the sacrospinous ligament. Clear to all of you? So keep revising all these points, especially the landmarks, what all are the diameter of brim, inlet and brim or inlet, cavity and outlet. So they are different, right? Anterior, posterior, oblique and transverse, they are different in case of all three portion. So let's see once again. That is anterior, posterior, it is 11. Cavity, in cavity all are same, that is 12. Outlet is 13. Oblique, this is 12 for brim and all are 12 cm in case of oblique, brim, cavity and outlet. Transverse, it is the opposite for anterior, posterior, that is 13, 12 and 11. Okay, it is little bit confusing, but if you keep revising, it will be easy for you all. In next class, we will be studying about fetal skull. So till then, keep studying and thank you so much for hearing me.